Hey, everybody. Good morning. Welcome. What an amazing morning. Here we are earlier again. So September is Cholesterol Awareness Month. And while there are many treatment options for those living with the bad cholesterol, the LDL, we have somebody with us that's so amazing on this topic. He's a cardiologist. It is Dr. Seth Baum. Thank you so much, Dr. Seth Baum, for being here with us this morning.
Well, thank you for having me. It's good to be here.
Oh, you're so sweet. And of course, the elephant in the room is, can you discuss how the LDL, also known as bad cholesterol, can increase a person's risk for heart attack or stroke, and what people can do to lower their LDL cholesterol? And of course, we want everyone to have the good cholesterol. So we'll talk about that too. So just tell us what we can do to lower that number, and particularly what really causes that number to go up.
Okay, yeah, absolutely. Well, first of all, it's important to understand the context that heart disease remains the #1 killer in the United States. And LDL cholesterol, which has been dubbed the bad cholesterol, and we can, discuss the difference between LDL and HDL in a moment, but the bad cholesterol, LDL, causes our arteries to clog and can lead to heart attack and stroke. And it's a major cause of heart attack and stroke. So it becomes very, very important for us to, #1, know what our LDL cholesterol numbers are. And then #2, reduce those numbers to what can be called safe zones. The really good news is we have a lot of therapeutics, a lot of medications that can do that. And they're great tools for us to reduce LDL cholesterols down to very, very low and much safer levels. The problem is insurance companies often push back and block access to these medications, even after doctors prescribe them.
And that's horrible.
Yes, it's horrible.
I don't
Yes.
understand how they could make that decision when it comes to somebody's life, literally somebody's life. So why are patients having so much difficulty accessing the care they need when, again, it's life and death? Aren't you under some kind of oath that shouldn't happen?
Yeah, it's a great point. So the people who take the oaths are the doctors. So we take that oath. The insurance companies don't take an oath, and they do get in the way, and they do block access, and it can be very, very problematic. In fact, there's this class of medications called the PCSK9 inhibitors that were FDA approved in 2015. They, in my view, are the greatest cholesterol-lowering advance in 30 years since the statins in 1987. I mean, they're that important. On top of statins, they reduce cholesterol 60%. So they're very important. They reduce cardiovascular events like heart attacks and strokes. Yet, when we prescribe those drugs, over 90% of the prescriptions are actually initially denied by the insurance companies, leaving us, the physicians and the patients, to have to fight to get access. And most of those people do not end up getting access. So it is a real problem. And then on top of that, we know that reducing LDL reduces the risk of heart attack and stroke. I've mentioned that before, but it's also the speed at which we can reduce it that matters. So the Family Heart Foundation did a very important study and published it in a very important journal, which demonstrated that just having months of a lag in getting access to the PCSK9 inhibitors resulted in strokes and heart attacks, unnecessary strokes and heart attacks. So although we have the availability of those drugs, the access is really often a problem.
And whenever I've noticed personally, this is my personal opinion, I could be off somewhat, but whenever there's already those challenges that exist, it seems like our minority population, our brown and black culture, people, our ethnicity groups, there's even a bigger disparity there for them accessing this health coverage that they need. So what can we do? And the second part of that, are the studies showing that African American and Asians and Latinos that number is higher? Because you said it's still #1 in the cause of deaths. And I know your studies show that. Is it higher for people of color? Because we tend to have less access to really good, amazing health coverage for whatever reason they're telling us.
Yes, it is. There's definitely a disparity there as well. So, and we need to do more about that as well. So, African Americans are in a situation where, they have to push even harder to get access. The problem is a lot of people don't frankly even know about these medications or even know their LDL number. So, it's important to spread the word for people to be proactive, to go to their physician, to ask for their LDL number, to be identified, to understand what it means, and then to push for the drugs that can reduce that LDL so that cardiovascular risk, diminishes in kind. It's very, very important. It's just very important to be your own advocate. There's a great resource actually called LDLSafeZone.org, which is through the Family Heart Foundation, that patients should go to in order to get more information and to be able to sort of be their own advocate even better, more effectively.
So you kind of answered my next question, which is, do you have any advice for anyone who is having trouble accessing health coverage challenges? And I just wish that the pharmaceutical companies and the insurance companies didn't have the control that they have. It should be between, the doctor and the patient. So what is a healthy LDL number, Dr. Baum? And then what is a number that we should all be concerned, even if our doctor saying, "Oh, well, you don't have to worry about it. It's a little high, but no, there should be no but."
You're right about that. Well, if the doctor says it's a little high, that's an indication that you should really push toward doing something about it, right? But the problem is, well, it's not a problem. We do something. We treat according to risk, and so we stratify patients on the basis of their age, the other cardiovascular risks, whether they have diabetes or not, whether they have a family history, to determine an appropriate LDL level for that particular person. So it's very individualized. However, there is an overarching understanding, and that is the lower your LDL, no matter who you are, the lower your LDL, the lower your risk, the better off you are. So some people advocate for getting everybody's LDL very, very low. And frankly, on a personal note, I'm not opposed to that. But that's not what our guidelines stipulate. There's very important strata that basically demonstrate where we should get our patients' LDL to a safe zone, if you will. So I can't give you a single number. Not trying to be evasive, just can't do it.
Okay. So we should know that number, whatever it is, and then we should, according to that number, change our diet, our lifestyle, to become healthier. And what we're seeing, Dr. Seth Baum, is more, to me, and I don't know, because we have more access because of social media, but there are so many more heart issue concerns where people are having heart attacks, they're having the cardiac arrest, from teenagers to preteens, and of course the older population. So I don't understand why there isn't like a horn blowing, because this is to me is so out of control. And then there are medicines that can help that. I don't understand why we have to have this conversation other than pointing people to the information. So we need to advocate for ourselves, but we need to know more information, Dr. Baum. So what can we do? And where do we go?
Yeah, look, I share your distress. It's insane. We know LDL causes heart disease. We know it. This is fact. This is not theory anymore. We know the lower the LDL, the better off people are, the lower their risk. We have the medications to reduce the LDL down to wherever we want to get it, wherever you and your doctor feel it should be. And yet we have these barriers, and the barriers really, are the insurance companies. It's actually, believe it or not, it's not the pharmaceutical companies; it's the insurance companies here.
I agree.
Yeah. So okay. we need to stand for ourselves, advocate, go to LDLSafeZone.org, and all band together and fight this fight.
And we're going to do that, Dr. Baum. You have to come back. I know you have to go. We're going to wrap it up. But thank you. I really appreciate your honesty and your transparency. and your passion for this work, and the Family Heart Foundation. Thank you all for that work. So please feel free to come back on, because we got to get ahead of this, and we can do it with conversations and awareness. Thank you, Dr. Baum.
Anytime. I'd love to. Thank you.
All right. Bye-bye. All right, everybody. So good morning. It is Tuesday morning. It's early. I had to come on earlier than what we have been doing because I have an all-day seminar that I'm going to attend. So thank you all. Please advocate for yourself and your loved ones. Know what, get involved with the research. I know that's scary because, especially for people of color, we have every reason to be leery and untrusting, but we have to get on the other side of that untrust, because it can save our lives. So we need to know what clinical trials are out there. We need to know the medicines that are out there. We got to push, especially when it comes to LDL. There's a ton of medicines out there that have been approved, that have a track record to lowering that LDL, because like Dr. Baum says, it causes heart attack and stroke. I mean, we all know somebody, if we aren't that somebody, who has had a heart issue where it caused them to have to be go to the emergency room, have heart surgery, have to get on a medicine for it. So when you go to your physician, even if it's just a checkup, a follow-up for even your little finger is not feeling well, ask them, what is your LDL? Please know your LDL, and then make sure they're telling you if that's what that number is, if it's relative enough that they need to seek treatment options, because there's no such thing as this high, but we don't have to do anything right now. Yes, you do. Yes, you do. You have to do something if it's not anything but gain more information and know what drugs are out there, what medicine is out there to help lower the LDL, because a high LDL is not good on any day. It's not good on any day. You could be feeling good. You could say, I don't feel like, you don't know, because sometimes our bodies get so used to functioning in pain and trauma and stress that becomes our norm. We normalize that. So don't do that. Please know what your LDL numbers are. Know what your blood pressure numbers are. Know what your waist. Even your waist is an indication. That number is an indication of whether you are potentially could become a victim of a heart or a stroke issue. So know your LDL and then act upon that. Everybody, let's move more. Let's eat better when we can. Moderation, right? We have got to advocate for ourselves and our loved ones, and we can do this. We can do this. And so, of course, the Loretta McNary Show is going to do her part. We're going to do our part. So today I want you all to choose joy, be kind to everyone, because everybody is dealing with something. And we all have a bad moment. We make a bad decision. We make a bad statement. Let's learn how to cover that with grace, because that same grace that you give to somebody else, you'll need it on the other side of that conversation or another conversation. So stay positive, dream big. Please think positive, dream big dreams, and help someone along the way, and go out and have yourself an amazing day. Until the next time. Bye-bye, everybody.